Chapter 20, Excessive Bleeding Following an Extraction. So obviously, as a hygienist, we're not going to be extracting teeth, and usually after a tooth has been extracted, they don't send the patient back to the hygienist for a cleaning. But sometimes before the site where they extracted the tooth is completely healed over, and it takes a while, then they will send them maybe for a cleaning. So you will see kind of the last part of it, but they could have had some emergencies on the dentist side, and this chapter will describe a few of those instances, and it's nice to know what's going on or possibly going on the other side before you get the patient a little later on. So this is going to be over complications that can occur after an extraction. At-risk patients for extractions would be a hemophiliac. This is a problem with a person who has a blood dyscrasia or blood disorders, and when they start to bleed, they're missing the anticoagulant or a coagulant enzyme, and so their blood will not clot and heal up. It just keeps flowing. So patients taking anticoagulants, which are blood thinners, and patients experiencing a hematoma. Hematoma is another word for a bruise or a contusion, and sometimes it can develop into a site that's also bleeding. It's when the blood is pooling and kind of comes up toward the surface of the skin, which is like a bruise. So excessive bleeding, hemophilia, it's a hereditary bleeding disorder. And like I said before, it's a deficiency of a clotting factor, and it can be mild to more severe. So these patients require special care for extractions. Some may require a recombinant, a cloning factor injection, or an IV prior to surgery. The use of glues, gelatin packing, and absorbable sutures could be an issue. We would need to try to use a vasoconstrictor, which would most likely be epinephrine, in the local anesthetic. Compression for 3 days following surgery. So at risk, continued, could be various medications, often prescribed for post myocardial infarctions or a heart attack, angina, which is chest pain, a CVA, which is a stroke, or a bypass, or a DVT, atrial fibrillation, and embolism. So risk of bleeding depends on the type and dosage of medication. So anticoagulants, aspirin, warfarin, heparin, clopidogrel, dabigatran, exteliate, and I'm not sure how to pronounce that next one, prasergil or sergiril, but these are all types of anticoagulants that you may see listed on their medical history. Particularly, you might see warfarin and heparin, aspirin. And of course, before an extraction, they would want to, most of the time, stop any of those anticoagulants. The exception being maybe a warfarin or heparin. These are given to people by their medical doctor, and sometimes the doctor will say to forego the warfarin or heparin for a day before they have the dental surgery or extractions. And sometimes their condition is bad enough that the doctors don't even want them to go an entire day without it. So they may go ahead and say they need to keep taking them. So this is something that if the patient is talking about that, you would need to confirm everything with their medical doctor. So herbal medications like St. John's wort or ginkgo biloba, ginseng maybe. The problem with these herbal medications are that they're not regulated, and a lot of times if someone is on herbal medications, they'll ask them to stay off of them right before the surgery. So the herbal medications aren't really well understood as far as medical advice goes, so they just tell people to stay off. Warfarin, there's 3 categories: low, moderate, and high risk. A low risk would be someone who no medication change needs to be made. Moderate, withdrawal 48 hours prior to the extraction. They're going to withdraw warfarin. High risk, you need a consultation with a physician, needs to determine the risk of bleeding versus clotting. And the doctor should be able to answer all that. So usually these people that have a problem with warfarin and excessive bleeding have an INR, and usually they already know their INR number. It's the International Normalized Ratio is what it stands for, and it determines their clotting time. It's used during warfarin therapy by their medical doctors, and you want the patient to be in a 2.0 to 3.0 target range. Heparin is used for thrombogenic episodes in hospitalized patients undergoing complicated surgery. These are people who have a tendency to form clots. So this would be used for someone as kind of the exact opposite of the warfarin. It reduces blood clotting immediately. It's going to be a blood thinner. Short acting, it doesn't last for very long, but there's no need to discontinue for simple procedures like an extraction, a tooth extraction. Aspirin is used to treat ischemic heart disease, TIAs, strokes. Minor oral surgery is acceptable on patients with a low-dose aspirin regimen. Low-dose aspirin is usually the baby aspirin, which is 81 milligrams, which is all in one tablet. The use of a local anesthetic, which is an LA, and compliance with follow-up procedure yields minimal post-extraction bleeding. So when they're talking about use of a local anesthetic, they're meaning the use of a local anesthetic with a vasoconstrictor with it. Excessive bleeding, hematoma, is a collection of blood trapped beneath the skin caused by trauma, including local anesthetic injections. Careful and knowledgeable injection is the best prevention, and you will be learning that in later terms. The most common problem associated with dental surgery is a hematoma, which is a bruise. If the hematoma occurs, apply firm pressure with gauze until no longer expanding out. So you can place a cold pack and possibly use antibiotics. But if the expansion of this bruise keeps continuing outward, then you would call EMS. If every day it's going outward, a little bit more. Signs and symptoms of excessive bleeding, easily recognized. Heavy bleeding unaffected by compression lasting up to 2 hours. So that's why if they're heavy bleeding and they are lasting for a long time, longer than normal, you would want to contact EMS. Also look for a fever, a low blood pressure, altered mental capacity, and a hematoma if someone is bleeding excessively. So treatment and prevention of excessive bleeding, post-surgical instructions, if they pay attention to the fact that they should not be exercising for a good 12 to 24 hours. They need to lie down with their head elevated for several hours after the surgery. They can place gauze or a tea bag over the socket of the extracted tooth and apply pressure for at least 2 hours. Can use a wet tea bag wrapped in gauze and bite on it. The tannic acid helps to provide clotting from a tea bag. That can sometimes help. Oozing blood for 12 hours is very normal if it just kind of oozes out, but a steady flow for a long period of time is not normal, and that's how you would know the difference. So here's the use of a tea bag following extraction. You just wet that, wrap it in gauze, and have them bite on that for a couple hours. If instructions are followed and bleeding is steady or heavy, follow-up treatment is indicated, which means that you would need to follow that up and possibly tell them, if it's bad enough, you can tell them to go to the doctor or the ER. So that kind of wraps it up on excessive bleeding.